Welcome to The Owl Hoot, a podcast for the environmentally curious, with me, Caroline Norbury. On each episode, I chat with a guest who contributes in some way to protecting the planet on matters of climate change, sustainability, biodiversity and pollution. Here is a place where you can gain new knowledge and be inspired. Enjoy listening. Here with me on the podcast today is Dr Helena Clements. Helena is Associate Medical Director at Sherwood Forest Hospital's NHS Trust, and until July this year she worked as a consultant paediatrician. Helena has been living sustainably in an eco-house for over 20 years, and within the last 5 years she's been driving climate action and sustainability within the Nottinghamshire health community. She is the Climate Action Clinical Lead for Sherwood Forest Hospitals and Clinical Lead for the Greener Integrated Care System. I'm so looking forward to hearing about the sorts of changes occurring within the NHS, so it is my absolute pleasure to welcome Helena to the podcast.
Hi, nice to see you.
So I'm going to start by asking you, Helena, a bit about your early life. What was it in your early life that led you to want to live sustainably in the first instance, but to have the sort of environmental climate very much on your agenda?
So I think it really goes back to early days as a newly qualified doctor. And I was actually born in Africa, and my parents had talked very fondly about their life out there. And I did a student elective in Sierra Leone. And it became very much something that I wanted to do as a young doctor. So my husband and I went out to Namibia with voluntary service overseas when we were in our sort of mid to late 20s for about 2.5 years. And had an amazing experience. So, I didn't really have a lot of knowledge. I was a budding paediatrician. I just passed my exam, so I was helpful, but certainly no expert in anything. And it was just a very impactful time for us both. My husband's an engineer. And what became really clear to us as we were trying to help develop health services in a rural African hospital, Namibian hospital, was that actually development and sustainability needed to be back in the West, if you like, in more developed countries, because they were really aspiring to have everything that we have here in the UK. And actually that isn't going to be possible for the whole population of the world. And that was very clear to us. And actually, rather than saying you can't have what we've got, we felt as a couple that we wanted to go back and look at sustainability and what that really meant going forward. And it was sort of just, obviously stuff has been known about climate change for a long time, but it was really sustainability rather than climate change, which was the buzzword then. And so we came back to Nottinghamshire, and our housing project where we live was looking for a family, and it just fitted exactly with our needs. And so I carried on with my paediatric career, and we built our sustainable houses. But it's always been there in my life. So I used to have two different separate lives. One was, Helena Tilly as a wife and a householder and a mother in my wellies and my jeans, digging and whatever. And then I'd be at a hospital as Dr Clements with my high heels and my dresses on, being a paediatrician. And those two lives were very separate for a very long time. And I had a conversation about 5 years ago talking about what had happened in my life over time. And I suddenly realized that actually the climate stuff, which is becoming increasingly important, particularly as I became a grandmother, actually, was we were sort of doing as a couple. But actually, because I'm now a senior consultant and a medical manager, I could use my influence and power, if you like, to actually think about climate from within the NHS. And that realization was a total epiphany for me. And I immediately joined those two things together. And I talked about it a lot. And we were a trust that had been in quite significant difficulty in coming out of the other side, and had a very energetic CEO with Richard Mitchell and a very thoughtful and energetic executive team who were prepared to listen to me and acknowledge that climate actually was everybody's business and we all need to do something about it. So They did actually fund a small amount of climate action work for me to do, which I think has been really unusual. There aren't many funded doctors to do this work, and although it's only 2 hours a week, it's really important that that is seen as important enough, as well as the clinical work that I was doing. And since then, I've really, been working very closely right across the trust. We've got a climate action team, which is extremely multidisciplinary. And of course, climate has become more and more higher and higher on the agenda. So we now have a greener ICS group. And because I was chomping at the bit to be heard and to really spread the word, I fell very naturally into that role as well. So I've been leading our Nottinghamshire group as well. And for me, it feels now the most important thing I can do before I completely finish my career. And I've absolutely loved being a paediatrician. And in fact, I very much thinking there's no point working on children's health if they don't have a future. And it was a very black and white sort of thought in my head. And I have been very lucky to have a new younger doctor that has been able to take over my work in paediatrics and children with developmental needs, to free me up to spend more time thinking about this. And that's been absolutely great. So I now I'm doing that, as well as quite a broad portfolio in the trust, which does include paediatrics and transitions from children's to adult services. I'm also very interested in end of life and safeguarding. They're all things that I have done as a paediatrician, but for me, that interface between everything that's good for health is good for the planet. And actually, we can't fix everything in health, and people do die, including children, but actually we should be working really hard to make that as dignified and as good as we can, often at home if we can succeed with that, and make those good events at the end of life. But actually that fits entirely with all my thoughts about how we do the right things for the planet and our resources as well, in a sustainable health service. So if we can work on public health and healthy children, we should have then healthy adults who don't fill our hospitals and have productive, healthy lives instead. So all of these things I often refer to joining the dots. All of them make sense to me, and all of them, if we get it right, will actually reduce our carbon impact. So those are all things that I'm very, very passionate about. So that's sort of a bit of a romp through my my clinical pathway and where it started. So working overseas and wanting to do something sustainable.
It's super interesting that you've gone from having kind of separate identities and being almost like two people, and then all of a sudden all of these things are coming together, whereby you don't see anything on its own. It all interconnects, which is fascinating in itself. Because obviously health is a huge topic in itself, and obviously within the hospital there are lots of avenues you could take sustainability and carbon emissions. Where did you start in that process?
It's a really good question, and I'm interested in everything because my other life involved living in a low carbon building. I'm interested in food production and sustainable food, healthy food, organic food, all of that stuff. I'm interested in low carbon houses, and that makes me interested in fuel poverty, actually, and of course the energy crisis is very much linked to that. So when I approach it within the health, I find it really difficult not to be interested in everything, and I've my poor colleagues will sigh, because I do have an opinion about most things, and when we talk with our greener ICS board for the Nottinghamshire ICS, I've usually got a comment about all of the different themes that we're looking at, be it transport or the building or water use or food, as well as healthy pathways. So I'm not very good at sort of limiting myself, and it means I just spend more time thinking and talking about it, I suppose. What we know about carbon emissions in the NHS is that 60% are from clinical activity. So yes, we need to make our buildings greener and more efficient and save energy, but actually that is a relatively small amount of a very big picture, and the carbon impact of our medicines and our consumables, and all of the things that doctors and nurses and therapists do in hospitals is the vast majority of our emissions. And so these clinical pathways, and greener prescribing, and all of those things are really, really important. And so what I've really been trying to focus on, particularly at the moment, is engaging clinicians, so doctors, nurses, therapists, to really think about all of the different aspects of health and health promotion, and greening that if we can. But I am interested in all of the other bits. And I sort of want doctors to be interested in housing. And, we need clean air to improve lung health. So actually, to have clean air, we need to have better transport and green spaces. So I'm trying to sort of get people to join those dots. And so I think a lot of what I do is that dot joining process and talking about it in a lot of different fora, really.
It sounds like, I'm just making this phrase up, you're like a networking evangelist, where you're trying to make sure each different department or type of person that's working within you is looking at some aspect. Yeah. Because the NHS is diverse in terms of staff, you've got all your clinicians and caring staff, but you've also got administrative type staff. Are the different types of people that you're engaging with, are they getting on board with it? Are you finding different groups are like, okay, I can see the link to health and therefore it motivates me, and other people are going, oh, I buy things for the building and therefore that makes me curious? What are those sorts of links with staff been like?
So it's been a very organic thing, in that, we have a climate action team, and that was just me getting out there and saying, if you're interested in joining me and helping develop things. And the group of, regular attenders includes nurses, therapists, admin staff, general managers. We've obviously got estates, and the sustainability team. I've got representation from the catering department, waste, so comms. So I think, actually it's people who are just keen, have got involved. But when you start to have conversations with anybody about their particular line of work, and I bring in something about climate action, most people will say, yeah, I get that. There might be some buts and ifs, but most people are engaged with that. The other thing that's really key about the NHS is that 1 in 20 people work in some form within the NHS in this country. And if you think about that, so 5% of the population who then go home and talk to their families and friends and their community, we are an enormously influential bunch of people if we choose to use that. So quite a lot, when I'm talking to people about climate, I always talk about the sort of 3 different forms of climate action. And so there's our personal actions, and lots of people are interested, what can I do at home? And we talk about that. And then there's the corporate, which is what do we do in our hospital? And potentially you can increase that to the ICS. And then there's the political stuff. So, and I try and get people to think about that, what they can do in each of those areas, because, depending on who you are and where you are in the NHS, you may feel that you've got no political power or you've got no corporate power, but I can recycle or I can save energy in my home. And that's just as important. And when you multiply that by 5% of the population and the people that they influence, you've then potentially got an enormous groundswell of people who can make a difference. And yeah, so I think it cuts right across the NHS, and people understand it. And also because it's about, everything is linked to health, people sort of get that as well. We're here in the health service, we want to make people healthier and do the right thing and think about our children and our children's future. It makes sense to people. So I think that has been a very potent way of amplifying the impact.
It's amazing the point that you make on the reach, the potential reach of that has got power in itself, hasn't it?
Yeah.
Even if you perhaps, I don't, this is the next question I've got in my head is because you've got this quite a big, nice bit of power. What about the political power? Are you getting anything coming down from government about how the NHS is looking, or is it all pushing upwards? Which direction is it?
So yes to both, and I think that doctors and nurses and maybe patients, I don't know, underestimate how much power they have, and I think we should use it to demand a healthy future. So I think there's that bit, but actually NHSEs and NHS England are also very engaged with this. So we've pledged to become a zero carbon NHS service by 2040, so brought that forward 10 years, and increasingly year on year they're giving us targets and some resources to make that happen. So even just pre-COVID in 2019, I was going to conference, our college conference, our Royal College, and saying, why aren't we talking about climate change in the NHS? And now, our Royal College of Paediatricians has got a whole climate action team, and all of the Royal Colleges have got climate action groups working on this. And then not NHS England similarly are performance managing us to say, how are you addressing this carbon reduction? And so I've just seen a graph of how our hospital at Sherwood is going to go from this much energy and a carbon footprint to this by 2040. And it's a huge ask, because actually, as we speak at the moment, our ill health population is growing, and so our costs and our impact will grow unless we do something drastically different. And that's, we've got to turn the tanker, and I think that's really difficult, and we haven't got much time. So yes, there's quite a lot of push down politically, which is really, really welcome. I think that we can push up as well. And because even if the NHS succeed this, there's so much more. It can't just be about us making ourselves zero carbon. It's got to be about oil and gas extraction, fossil fuels. It's all of those things. Otherwise, we're not going to win this. And just to follow on something you said about reach, again, that's really important. Not only have we got the staff reach, but of course we can influence our patients. So if we can help our patients be healthier, that's a green tick for the planet. And actually we can talk about the planet and the climate emergency and the health emergency, because those two things interlink directly with our patients. So that reach is even greater if we choose to use it. And for me, that's has enormous potential, but it needs people and energy. And when we're looking at another really difficult winter and fuel poverty and all of the other things that are impacting on all of us this winter, it's quite hard to get people to prioritize climate stuff, except that people want to reduce their bills, and by definition that will be reducing energy, but if we can help them to do it. So there's a lot to do and a lot of potential.
For sure.
If we can grab it, yeah.
And in terms of that patient conversation, how do you envisage that sort of happening, that you're trying to tie in, this is how you can be healthier and this will help the planet too? How do you envisage that conversation occurring?
I think that's something that we need to practice, and it's not easy, because if you are offering people opportunities to have a low carbon alternative, or say not having an operation or having an operation, and one of them is cost less and is less carbon, and the other one might fix them for a bit but not for very long, or whatever, trying to get people to weigh up the pros and cons of that and the immediate compared with this medium term, it's not even long term view, is quite a difficult conversation, particularly when you're making decisions about health. But there are things that we can start to get people to think about, like a healthy diet. A healthy diet is a lower carbon, less meat, a plant-based diet. Managing a good weight and getting exercise is, and maybe leaving your car at home is good for air quality, is good for the planet, and it's good for us and for our children. So we can start to build that in as sort of part of these are good things, not penalties. And some things are really easy. If we talk about recycling or safe disposal of inhalers, not recycling, but disposing of them safely, people will hear those kind of messages and want to do their small tasks that people will want to do. So I think we can build on that. And because the ask for becoming a lower carbon economy is going to increase and become increasingly obvious to people, it will be easier to have those conversations as we progress as well. So I think it's just going to take practice. And I don't have all of the answers now, but I think as a paediatrician, it's easier to talk about it, because those children that I'm trying to keep healthy now, we need to keep healthy for the next 80 years as well. And we need a healthy planet for them. And so those kinds of conversations I think are going to be a bit easier to have and engage children and young people, because they're learning about it. They know more about it than most adults, I think, these days. And I think we'll engage with that as well.
Yeah, I can see how that will be helpful. You mentioned food there, which I always think is particularly interesting with the medical profession, because I think historically food hasn't been in that conversation either. And obviously you're the medic, so I'm going to abstain to your professional opinion there. But I've always felt that it's been a bit of a side issue, food, and it's only just kind of coming in with certain, in my world of podcasting, there are a couple of doctors out there that are really into podcasting and sort of selling the idea of how nutrition can really be complementary to health. And also that ties in with the whole, as you say, the how do we lower carbon through food as well. So that's a really nice mix. Do you find you're drawing in those sorts of conversations that again make more connections to these sorts of perhaps under chatted about conversations?
Yeah, I think it's really important. And it seems really obvious that the food that we put in our bodies must be important for our health, and yet we don't talk about it. And as a pediatrician, unless there's a problem with the gut, I tend not to discuss it, or a weight issue. But it's very medicalized, and I think what we don't do is just basic. What we all need is to know how to cook from first principles healthy, nutritious food that isn't full of harmful calories, but healthy calories and vitamins, and has been grown locally if possible, and be more plant-based. And I think it's not about taking away choice. It's about really engaging with that and moving away from a culture which is based on the supermarket culture, cheap food, and you can see why it's very appealing, because bad calories are generally cheaper than good calories, sadly. And we need to have those conversations, but in that whole, from a health perspective, as much as from a climate perspective. But that needs to be followed up by education, and teaching people to cook again. All that sort of stuff went out of the curriculum, I think, and it's such a pity. And many people, who are very well educated, don't know how to cook, or using leftovers, saving money. So I think there's so much that we can do, and linking food growing with health. So at Sherwood we launched in 2021 the Hope Orchard, which was really trying to link the sort of post-COVID recovery with health, environment, mental health, and joining those dots again. And so we've planted a lot of fruit trees, both within our trust, but around in the area, and linking, just sort of making people think that a fruit tree and eating fruit is a healthy thing, as well as trees supporting the planet and all of that sort of stuff. So the Hope Orchard is a virtual thing. There are trees at Sherwood Forest hospitals. There's trees in my garden which have been signed up to the Hope Orchard, and I gave one yesterday to a consultant colleague who's retiring, so she got a plum tree. So it's the concept of just trying to get people to think about health and food and the planet all at the same time, which for me works.
Absolutely. There's so many multiple wins there, isn't there? If you tie all these things together, absolutely. It's great.
Yes.
So you mentioned the green plan earlier. If you can talk about it in brevity, I'm not sure how big or wide it is, but what's in the green plan?
So every ICS, which is for the county integrated care system or integrated care board, has developed a green plan. So this is right across the country, and every trust will have a green plan as well. So those were must-dos by this April, and they're both at a trust level and an ICS level, and I guess at a national level they're broken down into different chapters, and there's 9 chapters in all. The ones that I'm particularly interested in are on lean pathways, the medicines pathway, the medicines group, food and nutrition. And then there are other chapters which are looking at transport, because people have to come to hospital to work and for their appointments. So there's a lot of and linking up hospitals and the supply chain procurement. So supply chain is really critical. There's an IT chapter. There's a chapter about people and growing the right kind of people in tomorrow's NHS. So there's a chapter on that. And obviously there's the buildings, so looking at lower carbon buildings, getting rid of oil and gas where we can in our hospitals, and certainly making any new buildings zero carbon if possible. And it's all of the trusts. So for Nottinghamshire, it's Sherwood, Nottingham University Hospitals, and the Community Trust, which includes mental health. But then we also work with public health and the councils and primary care. So it's everybody working together and sort of joining those dots so that everything links into a lower carbon health system. But it's broader than that, because it includes things like transport and food, which come in through our councils, education as well. So really, really exciting, and to sit at a board table with sustainability leads from the councils, as well as all of the other hospitals, GPs, public health is really exciting. One of our procurement leads was describing going out with a district nurse for a day, and understanding that, a nurse going out to replace a dressing on a wound, say, we procure very carefully in the NHS, but a lot of that's been cost-based, and actually some things might be cheaper, but if it means that the nurse has to come out 3 times a week instead of twice a week, then you've got more journeys, more cost, and an extra dressing. So actually all of those savings, if you add up all of that and what it impacts on the patient, those savings are not real, and sort of looking at it in a different way. And he could see that so much more clearly by going to a home and seeing a nurse in action, and that will change how he procures a dressing. And for me, that was really powerful. And I think, we need to be thinking like that across all of our different threads, which, for me is really exciting.
And again, it's making those connections, isn't it?
Absolutely.
And I imagine, because of the hugeness of the NHS and all the different levels, making those connections is going to be vital to getting things done. I've got 2 questions in my head. One is the positive. Which have been the quick wins, and what have been the frustrations? And I'm thinking that there's bound to be bureaucracy and all of that in there. But what has been easy to sort of get started on to make a change?
So some of the quick wins have been identified through, groups working on this over time. So one of the things we've done, which is a national programme, is reducing the metered dose inhalers, which have got a very high carbon impact. And that's work that's been done through hospitals, GPs, pharmacies, and really getting a joined up approach to this. And it's not that quick, but over the last year, that's been there's a lot of work done on that to try and get greener prescribing. But actually, fundamental to that is improving asthma and COPD care, so that you don't need to use your salbutamol inhaler all the time, which is your reliever, your rescue treatment. Because actually, if we got your preventative treatment right, then you're in better nick, you're healthier, and you don't need this bad inhaler, which is actually really bad for the environment. So there's a lot of work around that. And actually, the other thing is about disposal of those inhalers, and we can't recycle them easily, but we can safely dispose of them. So there's quite a lot of work around that. And because the gases in those inhalers are so bad for the environment, thousands, hundreds of times more worse than CO2, it is a quick win to address that one thing, which we are doing and is being done nationally. So that's one, and we've done quite a lot of work on anaesthetic gases, again, which are there's one particular one called desflurane, which is particularly bad for climate gases, if you like, for global warming, and the government have asked us to reduce each year the amount we're using. We've nearly got to naught, and that's a really important win, and it's getting people to think about some of these really high ticket greenhouse gases, if you like, and making a difference. Other wins are much harder to do, and changing people's behaviors. And the problem with procurement is its whole life cycle stuff. So if you have a medicine that I use in my hospital, it's had to be developed, it's had to be made somewhere, it's had to be transported, it's packaged in about 20 different layers of stuff which needs to be addressed. Then I prescribe it as a doctor, and it goes out to a household, and if they don't use it, it can't be reused by anybody else because that's the law, and so it then gets disposed of. So that kind of life cycle stuff needs an enormous number of steps to take out the carbon off that, and still have a good drug and effective treatments for our patients. So we need to do a lot of work on that kind of stuff, and some of it is easy. We can start to demand that things aren't packaged in 10 layers of cardboard, plastic, and more plastic. We can look at how things are reused and recycled, and that's tricky, but I think we will get there with that. And then transport and all of those stuff need to be addressed too.
So I was wondering, because of the size of the NHS, whether you are pushing back on suppliers and saying, I'm sorry, we want a product in a particular way in terms of packaging, or can you think about producing it in a different way that makes it more or less carbon emission impactful?
Yes, we are an enormous organisation, and I think we do have that power. I used to feel quite militant about this actually in the early years, and we must demand it and start posting the packaging back or something. But actually, what my colleagues in procurement are telling me, and the drug companies as well, which has been my particular pet hate, what they're telling me is that all of these businesses, get climate, and every business inside and outside the NHS and healthcare anyway is having to work towards these zero carbon standards anyway. So actually, it's going to happen whether we demand it or not. I think it's happening. We can try and increase the speed, but I think it is happening. So just like we've got a green plan, I would imagine that a big pharmaceutical company like AstraZeneca will also have a green plan. And yes, they've got a business model and they need to make profits, but they will make profits without wrapping everything in plastic and wasting resources that we don't need to do. So I think all of those things will happen. And the cost of not doing that and not addressing climate change, of course, will increase everybody's costs. And it threatens all of us, whether we're, individuals, health professionals, or we work in a big corporation. So actually, we're all working for the same thing. And so although we do have that buying power, and I think we should use it, I think the economics of climate change is such that those things are going to happen, but we just need to make it happen as quickly as we can.
And what are the frustrations, or perhaps you don't have any? Perhaps it's really easy.
I think the problem, I think I mentioned it earlier, is that the NHS is completely overwhelmed. So we're post-COVID, we are heading into a winter, which we're really concerned about in terms of just pressure coming through the front door and being able to manage that. And so it's really hard to push the climate agenda when people are just worried about getting patients out of A&E and into a bed. So for me, that's very frustrating. And it's very difficult to get people to think about a different model of healthcare when you're so overwhelmed. So, when we talk about a winter plan, I've sat through a winter plan every year for the last 20 years, and it's always the same, but we need more because we've got more sick people this year than we had last year. And then that's basically what's happening, because the demand on the NHS is growing all the time. Now, my vision of the NHS is that we have a health service and we spend money on public health and well-being, so that we reduce demand. But the problem is that the money that I want us to spend now will probably not see fruition for another 5 to 10 years. But if we don't spend it, we definitely won't see that fruition. And the frustration for me is that we are the NHS is, we've got a 1 or 2 year budget at best. And yes, we've got long-term plans, but if we don't deliver in year, it's very hard to get those resources. And I don't quite know how to solve that one. I mean, I talk about it a lot, and trying to get people to have a new vision for health rather than ill health, which is what our vision is at the moment, is quite a challenge. But actually, we absolutely need to do that. So, and we will see, the benefits if we have people who are taking exercise and have access to green spaces and use public transport, and so we've got clean air, then we'll have fewer respiratory problems. We might have less type 2 diabetes in our adult population, and all of the consequences of that. And that is a vision that we can realize if we all work towards it, but it needs investment in public health and education rather than in diabetes services and COPD, which is where the money's going at the moment. And we've got to have that leap of faith and the investment to do that. So that's something that I really want us to progress, but is really difficult.
Yeah, I can completely understand that. And it seems so very similar to the same approach to climate in its entirety, in that you want to go for this preventative and that'll just benefit the long term no end. And it's a bit like that for carbon emissions. We need to sort them out now, rather than having to worry about adaptation, and
Yes.
Look at the symptoms all the time. We need to be we need to be investing at the other end, don't we? And it's the same for the health service. So I understand that must be a huge challenge. Good luck with that.
Yeah, thank you. But we all need to go for it, and each of us can shout and use our voices in every way that we can. And I feel very passionate about that, and I refuse not to have hope. I've got 3 children, I've got a grandchild, and they I refuse for them not to have hope, and so I will continue to battle for that. And although the money isn't forthcoming, I think the understanding is coming, and I'm not getting. I think people have stopped thinking I'm a crackpot, and understand where I'm coming from. And actually, so what they want now is for me to solve it all. So I get lots of emails to say, oh, have you seen about this seminar, or what about doing this? But they want me to do it for them, and that's also a bit frustrating. I can't fix this on my own, and the 4,000 to 5,000 people in my trust need to fix it together, and I think that little bit, it hasn't quite.
Yes,
that penny hasn't quite dropped yet, but we're getting there.
Yeah, and so I'm interested because it would be very easy for you, because you are enthusiastic and you want to make it happen, and you've obviously got lots of interest within these different areas. How do you decide what's important, what you're going to attend to, and what do you do with all the other stuff, that all those extra demands?
I don't know the answer to that. I
Work in progress.
It's a work in progress. I do have to choose. I am trying to get resource so that I can get other people to do those things, and that's been a focus. And my the director of the Greener programme in our ICS is very supportive and is trying to tell me that I don't have to I have to do everything. There are people that can help me, and she needs my expertise. So I'm trying to do that, but I have, part of my reason for retiring from my clinical work is to give me that time, and I choose to spend it doing this some of the time, not all of the time, but it's very energizing, and I think to see the realization and the movement growing is really exciting. So, but yeah, I haven't quite worked out how to balance it yet, but that's fine. I'll get there.
And how do you see sort of the immediate future and the long-term future? Where is your vision?
Well, what's my vision? My vision is for a health service. I think we need to turn that tanker into joined up services for well-being, and helping people to be their best healthy selves. My vision for the future will be a low carbon economy where people access services close to home, where they are part of the solution, that houses are built with low carbon technology. You don't need a lot of technology, and that we have communities that look after each other and solve our own problems. So a lot of that can be locally based, and there are really good descriptions of that. And my own experience of living in a community of eco houses has been really positive, and brings me in daily contact with my food source, in that we grow our own food, with my environment, because I'm reacting to the temperature and what's happening around to manage my house, and living in a very beautiful place because we've made time to create an environment around us which improves my mental health and helps me to carry on doing all this other stuff that I do. So I think that would be my vision, and I completely accept that I am very privileged in my education, my job, my income, where I live, which part of the world I live in even, and that isn't going to be possible for everyone, but a lot of these things would be so positive for people who are struggling, and I think we should be trying to create healthy cities, healthy green cities, and communities as well. So I think that is a vision that we could make happen if we choose to. And that's and health is just part of that bigger thing.
That's just a super place to sort of end our conversation on, Helena, because it ties in everything, and it's a very positive way of embracing the future, but also having that realism of what needs to be done. And as you said earlier, you've got children and you've got grandchildren, and all of these things have come together for you, which is what makes your story particularly interesting, because the light has come on in all your different areas and you're bringing it all together. So I do wish you the very biggest success in driving this forward. It's a big job to be done, but and obviously you're not doing it alone, but carry on the great work, because it sounds so exciting. Thank you.
Thank you very much. Thank you.
I thoroughly enjoyed my conversation with Helena. Her networking evangelism is quite something, and her enthusiasm for driving climate action impressive. There is so much scope for reducing climate emissions within one of the biggest institutions in the world. And what I hadn't considered before was the influence they can play to the wider population through the spread of climate conversations by staff networks and to patients. I really admired Helena's expansive thinking and could see how every aspect of the NHS could benefit from an environmental lens, from purchasing to surgery to end-of-life care. Striving for good health outcomes too can go hand in hand with good climate outcomes. In producing this episode, I'd like to thank Andy Shaw for audio editing, Jeremy Jones for providing the music, and to you for listening. Don't forget you can follow the podcast to get automatic access to each new episode, and it would be lovely if you could rate, review and share it too. It really helps. Until next time, bye for now.